And good evening. Welcome to the 5 o'clock news. First at 5, with hospitals across the state on the verge of being overwhelmed by patients with COVID-19, Governor Kate Brown announced that more Oregonians will need to be vaccinated. The governor is now mandating that all teachers and staff in schools and all healthcare workers get the vaccine, with no option to be tested weekly instead. Fox 12's Simon Gutierrez is live in North Portland now with reaction to the governor's new mandates. Simon?
Yeah, Oregon nurses and teachers have broadly supported the idea of vaccination, but there are people who work in both of those fields that have strong opinions in the opposite direction. And on the healthcare side of things, they say there's a potential for some unintended consequences to these mandates. With 845 Oregonians now hospitalized for COVID-19 and 93% of the state's hospital beds full, Governor Kate Brown announced an effort to increase vaccinations, mandating that all teachers and staff in schools and all healthcare workers be vaccinated by October 18th.
We are all at risk right now when our hospitals are full. There may not be a staff bed for you if you have an unexpected medical emergency.
The Oregon Education Association, which advocates for the state's teachers, released a statement supporting the government's vaccine mandate. Local teachers' unions, meanwhile, will be working out the details with their respective school districts.
If some employees need to make sure that we have, paid time off to get the vaccine or recover from it, those might be things that we talk about, making sure people know how to access the exemption forms and fill out those paperworks and processes and make sure that the whole system is clear and people know what their rights are.
But among Oregon healthcare workers, there is significant pushback to the vaccine mandate, particularly the governor's decision to no longer offer the option of weekly testing. Linda Pond is a registered nurse and president of the Oregon Nurses Association.
ONA was hoping that we would be able to continue with the testing opt-out simply because we have some members that are very clear that they will not get vaccinated regardless of what the governor says and regardless of what their employer says, and they will leave the bedside before they succumb to vaccinations.
And although more than 80% of registered nurses and nurse practitioners have already been vaccinated, Pond says hundreds have expressed opposition to vaccines.
Staffing is already pretty dire across the state, and if nurses that are not vaccinated follow through with their comment that they're not going to get vaccinated and leave the bedside, we could lose a pretty significant piece of our workforce, especially in the rural areas that are already so crunched.
And the Oregon Nurses Association has been in ongoing discussions with the governor's office about some of these vaccine mandates, and they will continue to have those discussions, although it's not clear that the governor intends to reverse course on any of these things. The governor also said today that she's in talks about potentially requiring vaccinations for higher education and also workers that work in childcare. Reporting in North Portland, Simon Gutierrez, Fox 12 Oregon.